Good afternoon. I'm Dr. Michael Rybczynski, and I'm the Chief Clinical Officer at Penn Medicine Lancaster General Health. My thanks to the Acting Secretary of Health and the Department of Health for the invitation today to speak on the importance of continuing our work on COVID-19 vaccines. COVID-19 vaccines are the most valuable tool in our effort to stop this pandemic. After 18 months of fighting this virus, we are all searching for normalcy. Our healthcare teams are tired, they're burned out. Our businesses are struggling to recover. Our teachers and students want to keep our schools open. Vaccines provide us with a way out of this. Vaccines enable us to return to normal. So many of us have taken that first step to get vaccinated. In fact, we have almost 180 million across the United States who are fully vaccinated and 1.3 billion people across the world. In Lancaster County, under 50% of our total population, at just over 260,000, are fully vaccinated. As a result of this, with these relatively lower rates of vaccination, we've seen increasing hospitalizations compared to other counties in the Commonwealth. Our case volumes are similar to that surge in April. We have over an average of 80 hospitalized patients daily across the county. The average age of those who are unvaccinated and admitted to Lancaster General Hospital is 56 years old, whereas the average of those that are vaccinated are at age 71. As a family physician, I take care of newborns to our most elderly members in the community. And you should know that getting vaccinated helps to protect every one of those patients. As each one of us gets vaccinated, it helps to keep everyone in our community safer. While masking and social distancing will help to reduce the risk of becoming infected or transmitting COVID-19, vaccines are the most effective way to end this pandemic. Vaccines are especially necessary for those who are vulnerable. They can be protected, like the immunocompromised and our children who are too young to get vaccinated. As noted by the CDC, breakthrough infections are expected. Overall, rates of breakthrough infections are only about 1 to 2% over a 6-month period. This shows that COVID-19 vaccines are still extremely effective at preventing most infections. When fully vaccinated people develop symptoms from COVID-19 in a breakthrough infection, they tend to be less severe symptoms than in unvaccinated people. Those who are vaccinated are much less likely to be hospitalized or to die compared to those who are not vaccinated. Just last week, the CDC released a study of 600,000 people with COVID-19 across 13 states and cities through a period of April to mid-July. Those who were not vaccinated against COVID-19 were 5 times more likely to become infected, 10 times more likely to become hospitalized, and 11 times more likely to die. COVID-19 vaccines protect people from getting infected, becoming severely ill, and significantly reduce the likelihood of hospitalizations and death. Within Penn Medicine, about 80 to 85% of our patients who are admitted with COVID-19 symptoms are not vaccinated. The unvaccinated tend to be in the ICU. They require additional support for their breathing. They have longer lengths of stay in the hospital. Of the small amount that are vaccinated and admitted to the hospital, many of them are immunocompromised, or they have mild symptoms and they're actually admitted for reasons to the hospital other than COVID-19. Unfortunately, we are all struggling with this surge of COVID-19 with infections and rising hospitalizations. In thinking about the 20th anniversary of 9/11 this past weekend, we mourned the unexpected and tragic loss of almost 3,000 lives. In just the last 18 months, we have lost 10 times that amount, almost 30,000 lives in Pennsylvania and 650,000 lives in the US from COVID-19. As the country united after the tragedy of 9/11, I hope that we can join together again to get vaccinated, to keep our families safe, to keep our friends out of the hospital, and to ensure healthier communities. Thank you. Now let me introduce Acting Secretary of Health, Allison Beam.
Good afternoon, and thank you, Dr. Rachinsky, for having this event here today. Greatly appreciate it, and I greatly appreciate all of your insightful medical expertise in being able to allow us to really steady ourselves in what data we're able to share today. Pennsylvanians should be incredibly proud of the progress that vaccine providers have made to administer 12 million doses of the COVID-19 vaccine to date, fully vaccinating more than 7 million Pennsylvanians across this state. With more than 7 million people vaccinated, the data is clear. The vaccines are safe and effective at preventing severe illness. Today, we want to share with you current data we have on cases that occurred in Pennsylvania after full vaccination. According to the CDC's definition, that means these are COVID-19 cases, hospitalizations, and deaths that were reported for individuals at least 14 days after they had completed their full 1-dose or 2-dose COVID-19 vaccine. These are referred to as vaccine breakthrough cases, although the term breakthrough can be misleading because the vaccine is continuing to do its job, even against more recent variants, including the Delta variant. No vaccine has 100% efficacy, so post-vaccination cases are to be expected. It's important to also remember that COVID-19 vaccines were developed to help people stay out of the hospital and avoid death, not just positive cases. It's also important to consider that post-vaccination cases, hospitalizations, and deaths in the context of their extremely low likelihood for vaccinated individuals. As a population gains a higher percentage of vaccinated individuals, there may be an increasing number of post-vaccination cases, but the likelihood of these events remains much less common among the vaccinated population than among the unvaccinated population. In fact, the data that we are reporting today shows that the vast majority of COVID-19 related cases, hospitalizations, and deaths occurring in Pennsylvania since January occurred in people who were not vaccinated. Like Dr. Rapinski, my hope is that this data encourages everyone who has not yet been vaccinated to speak to their doctor about getting the vaccine as soon as possible. It's also important to note that the post-vaccination data being reported is not yet perfect. For example, the hospitalization data is dependent on timely, accurate, and complete reporting by hospitals. We know that hospital resources and staff have been under extreme pressure since the start of this pandemic. We're doing our best to work with hospitals and healthcare providers to improve the reporting and communicate it to the public as soon as we receive it. Starting today, you can find our full report of current post-vaccination figures on the PA Department of Health website under the COVID data page. Here is the most current post-vaccination data available in 67 counties. Between January 1 and September 7, 2021, there have been 35,389 identified post-vaccination cases, among a total of 639,729 positive cases. That means that 94% of cases reported during this time period were in unvaccinated or not fully vaccinated people. Case incidence among the unvaccinated and not fully vaccinated was about 7 times as high as the case incidence among the fully vaccinated. What this means is that compared to unvaccinated people, fully vaccinated folks are 7 times less likely to get COVID-19. Between January 1 and September 6, 2021, there were 1,820 COVID-19 related hospitalizations reported to have occurred in fully vaccinated Pennsylvanians. That is out of 34,468 total hospitalizations with COVID-19 as the primary or admitting diagnosis. That means that 95% of hospitalizations reported during this time were in unvaccinated or not fully vaccinated people. It's important to note that these data account for figures from approximately 55% of Pennsylvania hospitals and 69% of acute care hospitals that include 80% of acute care beds in the state. We're continuing to work with hospitals to improve the collection of this data. Among post-vaccination cases identified between January 1 and September 7th, 2021, the latest data shows that tragically 213 folks have died. That was out of a total of 6,472 COVID-19 related deaths. And that's among all cases identified in Pennsylvania in 2021. That means that 97% of deaths related to COVID-19 during this time period were in unvaccinated or not fully vaccinated people. Death incidence among the unvaccinated and not fully vaccinated was about 8 times as high as the death incidence among the fully vaccinated. In other words, compared to unvaccinated people, fully vaccinated folks are 8 times less likely to die from COVID-19. In summary, the data that we have is showing once again that even as the more transmissible Delta variant becomes more widespread, the COVID vaccines are safe, are effective, and help prevent serious illness and death. The vaccines are our best tool to protect ourselves against the virus, keep our children learning in school, keep our workforce in person, and to foster social and economic recovery. Every person who chooses to get vaccinated brings us one step closer to moving past the pandemic. We will continue to collect and publish the data that we have on post-vaccination cases, hospitalizations, and deaths as we get more data in from our hospitals. And we will continue pushing to vaccinate all Pennsylvanians so that we can reach 100% of eligible Pennsylvanians being vaccinated. Now, we are happy to address your questions about the post-vaccination data we're reporting on today. So nationally, as we discussed previously, this is quite aligned with where we saw federal statistics to date, and even more recent studies from the federal government were relatively close to the numbers that we're stating today. But of course, we're actually encouraged by the data and the efficacy of this vaccine preventing that hospitalization and death. So we are very closely watching federal advancements on booster announcements. As folks know, this is rapidly changing. Our responsibility as the Department of Health is to be prepared no matter what comes. And so we are really doing staging and scenario planning for whatever the federal government decides, but we want to allow them to have full deference on when we kick off a booster campaign.
And in this information that you're gathering for post-vaccination figures, are you able to break it down at all between Pfizer, Moderna, and J&J?
So we continue to have this vaccination data emerge. We were extremely excited to be able to even give Pennsylvania statistics today as we do more of our analysis, which again, as folks know, this is the same team that is actively responding to the Delta variant increases across the Commonwealth. We're going to try and have there be more detailed data, but of course that is again a time-consuming and resource-consuming exercise.
When did you guys start collecting the data? As of June 30th, when I asked your department about this, they've referred me to the CDC. Yeah. I circled with our 3 hospitals on July 2nd, and they said none of them had the capability to collect this data.
Sure. So this is actually an exercise that requires a multitude of data systems. And so not only understanding where our cases are, but also what the vaccination status of these individuals are, has been an exercise that we have been working with the CDC over the summer. More recently, we actually instructed the hospitals through an order to be reporting this data to us. And we've had a lot of compliance from our hospitals, but of course we're working really closely with the ones that haven't reported to date to make sure we can get compliance.
We know
2 weeks ago. I can check with our team to get you the specific date of that order. Yeah, absolutely.
Do we know what specifically, I mean, do we know what causes a breakthrough infection, under which scenarios a breakthrough infection is more likely than not?
Sure. At this stage, our data does not come to any conclusions about the why, but would you want to speak from a clinical perspective? Okay. Okay, great.
And what's going on with hospitals, some hospitals and some acute care facilities not reporting this data? I mean, what has been the story there, and why are some not participating?
Sure. So, and again, I'm happy to have others speak from the clinical perspective, but I think from an operations system, our hospitals right now are currently frontline responders, right? They're actively responding to, again, unfortunately, a surge in COVID-19 cases. For them, it's also a resource issue in making sure that the right data systems can pull an understanding of not just who's admitted for COVID, but who's been vaccinated before they report that to us. And so we are appreciative that this, again, is an administrative ask of them, but I think they also know the importance in showing the efficacy of the vaccine and how compelling this data really is.
Is that a statistically sound sample then? We're talking 55% of hospitals. You're confident in that data?
Correct. We have 80% of our hospital beds are covered in this data. And of course, we're going to try and get that last 20, but we think at this stage of the game, letting folks know where we are by way of how effective these vaccines are at keeping folks out of the hospital beds is a more important point to be out there right now than waiting for that 100%.
Having to divert patients through EMS because they're overrun. I mean, is this an issue that we're seeing?
Yes, so we actually are closely monitoring the diversion right now in hospitals in different regions of the state, and then also out-of-state hospitals that are diverting to Pennsylvania. And so, again, we know that the cases are followed by hospitalizations and deaths, tragically, and we've just undergone an increase in our cases, and just today we're over 3,500 cases. And so hospitals are taxed right now. The number one thing we can do is get vaccinated so that we don't overtax these hospitals further.
Where do people that need care go?
So I'm happy to turn it over if you want a clinical perspective, but that's the tough question. If you want to offer from Serge.
Yes, I'm absolutely concerned about the surge in Lancaster County. As I mentioned in my comments, over 80 hospitalized on average last week. It's concerning to us because it takes beds. It takes beds away from people that may be holding off on care. When you think about advanced cancer treatment, cardiovascular treatment, and they're coming in asking for services. It puts at risk those that want their elective surgery. They've been waiting this long time. They've set off days off work to try to have their elective surgery, and we're trying to balance from a hospital perspective what's the right way to do this. And many of us, as you're reading about in the news again, don't want to face the triage protocols that we've talked about last winter. So I think it's an advantage to us to try to work together to put those social distancing, masking, as well as vaccinations in place to try to prevent the increasing volumes.
Aside from Lancaster, are there any other close counties in our region that are really seeing this hard hit with just being overrun in the hospitals?
Yeah, I think when you look at central Pennsylvania as a whole from the Department of Health's early warning dashboard, many of the counties around Lancaster are 11, 12, 13% positivity. If you look at the case rates, we're 200 cases per 100,000. If you remember the stat from last spring, from the Department of Health, we wanted to be under 50 cases per 100,000 to be in control. We're 4 times that in the central Pennsylvania region. It's putting a stress on all of our hospitals.
Is there going to be a lag in these breakthrough cases reporting? Was there any time that we're missing in terms of a time frame?
Sure. So as noticed in the remarks, so this is as of last Tuesday. So of course, it's also been a heck of an effort to even get to last Tuesday with a lot of the reporting, but we're going to continue updating it as frequently as we can, realizing that this is a resource use as well. But yes, this was as of last Tuesday, so there is a bit of a lag there in data reporting.
Will we expect kind of a weekly update on the Pennsylvania Department of Health website? Can people be checking this regularly, or will you all be kind of announcing it as it comes research-wise?
Sure. So we're happy to do the announcement. I think we do the daily press release. We're happy to put in there when we do update that information as well, realizing that this is a lift on our team. We're going to try and at least have it updated monthly.
have the power to order mask mandates in schools?
Sure. So first and foremost, back to the point that we were on earlier, we're at 3,500 cases today. And we know that right now we have 10 times as many school age cases as we did at this exact point last year when we were doing virtual education. In-person education is so critical right now, and I think that the last school year has only proved how necessary it is to preserve it, no matter what means are necessary. And so for us, the masking decision was absolutely one of making sure we provide in-person education that is safe and can remain for students, and then also allow our economy to recover and have the parents going to work. So we continue to remain that we have the authority to move that forward. We want kids in school. We want parents at work, and we're willing to do that through these orders.
Can you say what the trigger was? Because I know that you and the governor at every press conference was hammered with this question about when are you going to implement more strategies, including a mask mandate. What was the trigger for you guys?
Sure. So there were a confluence of activities that took place the end of July into August. I think, as folks know, there was additional CDC guidance that advised that inside all students and all teachers should be wearing masks to preserve that in-person education. Additionally, we watched as the Delta variant rampaged across Pennsylvania throughout the month of August. Unfortunately, at that same time, we were watching as school districts did not pass masking requirements in their local communities. And at that point, that's when the governor called upon the legislature to say, please, you move forward with action in this space. And the legislature affirmatively said no. And that is when I think the governor felt that it was time to move forward on a masking requirement. Yeah.
Tracing and a data breach, did that have any effect on your ability to report those breakthrough cases? And if so, why?
No.
So that time frame that was missing between that data breach, there's no missing cases there?
This is complete for January 1 through September 7th. Any other questions? Yeah.
I don't know whether you or the doctor can address this, but what at this point, what arguments are you at the Department of Health or at Lancaster General hearing against vaccines? And besides, I don't know if there's any messaging besides vaccines are safe and effective, but any messaging that you're using to try to get at those specific arguments against?
Sure. So I'm actually going to turn this over to Dr. Rupchinsky because he's front line right now and working on exactly that. Go ahead.
Yeah, sure. So obviously we're working through everybody's opinions about the vaccine effectiveness and safety. I think that's the prime concern. Initially, months ago, when Penn Medicine asked for a vaccine requirement for our employees, we faced questions around the efficacy and safety of the vaccines and how long have they been tested. You have to put that into perspective at this point because the original trials from Pfizer and Moderna are over 15 months old now when you think about past July of 2020 and moving forward. And those patients, 35,000, 40,000 patients in the original trials have been studied for a long term. We talk about long-term side effects. There was concern about pregnancy and fertility risks, which I think have long been debunked as the American College of Obstetrics and Gynecology, the Society for Maternal Fetal Medicine have all come out in support of the vaccine, even during pregnancy. So some of those early myths and misunderstandings have taken some time to work through those conversations, but we've gotten to the point where I think people are really beginning to understand that. I also wanted to go back to a question about the collection of data, if I could, briefly, about the vaccine data that was collected between January and September. That was all in the hospitals to report that data. So in essence, the hospitals had to ask each of the patients, were you vaccinated or not? Because if they weren't vaccinated in the system or in the hospital that they came to, if they were vaccinated at a pharmacy and we didn't have that data, there was obviously a collection process that had to be done manually. And all of that data had to be collected manually at the hospital level and reported to the Department of Health.
Any other questions?
One more question for anyone?
Great. Thank you all. Take care.